Hi everybody, Dr. Garcia from Garcia Facial Plastic Surgery. Specifically, we're going to talk about the trends within our practice, the things that we've done in the past that we have found don't work as well, and we have moved on to other things, other processes to take better care of our patients. It's important to note that there are a lot of trends and there's a lot of marketing that takes place in the field of facial plastic surgery. In this practice, we don't necessarily follow trends. We are a results-oriented practice, which means that if things don't work for our patients, we move on and we try to give our patients the results that they're looking for. And we're going to talk about some of those technologies that we've been through in the past that we're no longer doing and the things that we now are doing to replace those older technologies. We're going to start talking about the skin and what things we used to do as far as the skin that have been replaced in our practice. I have with me today our esthetician Lori and our nurse practitioner Becky, who are going to talk about these different trends. And Lori, I want to start with you today. I want you to talk about the processes that we used to do in this practice, things that have evolved as far as pigmentary issues in the face, skin improvement, things that we used to do that you've transitioned into newer processes.
Okay. One of the first things that comes to mind is the MORPHEUS-8 from InMode. It's a radio frequency microneedling. It's a wonderful treatment if you can tolerate the pain that is associated with it.
The big downside with that was the discomfort.
It really was, yeah. So because you had to be able to take the radio frequency at a higher level, and then it was the amount of pulses that you were able to tolerate, most people found that they couldn't barely make it through one treatment, much less than a series of 3 of them or more if needed.
Right.
We tried many different numbing processes and things, and we just couldn't get it straight. So I've gone back to my SkinPen Microneedling. I have an advanced technique that I used that's a stamping technique.
And that's a regular microneedling.
Regular microneedling without radio frequency,
right.
Yeah. So you're not getting that skin tightening from the radio frequency. However, we are still stimulating that collagen production that comes with that. So, I mean, I've had excellent success with dog bites, scarring in general, and we've seen amazing results. We have a lot of before and afters of these results too. So it's just kind of back to the tried and true aspect of it.
Okay. Talk about how you now treat the skin with the addition of our new laser machine.
Yeah, so BBL has a wide platform of usages.
And that's broadband light.
Broadband light, correct. So basically I'm treating broken capillaries, whereas we used to have the Yag that Becky would use. The BBL is amazing for that now, and we've got good before and afters on that too. Pigmentation, all sorts of pigmentation. What I like about the BBL machine is that we now have the ability to use different filters to address different concerns.
Okay.
So you've got, the ability to do red and brown. We always had that ability with IPL, but we couldn't actually choose the filter we were using to target specific conditions. The availability to be able to do that is great, and we've had great results with our patients too. They seem to like it better, and it's also less painful actually.
Okay.
We do numb them, but it just makes it, a nice comfortable treatment when we numb them. But yeah, the results speak for themselves.
So in summary, as far as the skin resurfacing component, you've gone from the IPL, which stands for intense pulse light, to the broadband light, which is more comfortable, a little more effective in terms of results, and you've got a bigger broadband, so to speak, in terms of the things that you can treat with the broadband light.
Exactly.
Talk about how you integrate your normal routine skincare consultations. For example, if somebody just comes in, how have you changed the way that you treat these patients if, say, they want to treat sun damage or they want to treat large pores? How have you integrated these new technologies in with these types of patients?
That's a great question, or a great point to make, is that a lot of these treatments are great adjunctive treatments to each other. They're interchangeable with other providers within our office as well. When I sit down to do a consultation for a patient, I'm wanting to find out, first of all, what they're already using, what their concern is that they want me to address, what their lifestyle is like, because their lifestyle obviously plays a big part in what I can do with them. And then we go from there. We've gotten a lot of play with the broadband light lately because everybody has concerns with pigmentation, especially living in Florida. The thing is that everything that we do together can be done literally together. You might just have a week or two in between treatments in order to meet your goal, where we're making it safe. If I'm doing a chemical peel and then we want to do a broadband light, you need a little bit of recovery time for that too.
All right, Becky, I want to talk to you about some of the more aggressive treatments that the evolution that we've been through in the last few years, as far as skin tightening and some of the things that are a little more aggressive in taking care of the actual aging process. A couple of years ago, we started with what was a relatively new technology that we now no longer do in our practice. Talk a little bit about the evolution in the skin tightening realm within the practice.
Okay, so skin tightening is a big concern for a lot of patients. As we age, people start to see extra skin around the jawline, the jowls. We were really excited to get the FaceTite technology because it offered a minimally invasive way to tighten the skin of the jawline. The idea of it being minimally invasive would be that it would have a lot less downtime than, say, a surgical procedure. And we found it to be effective in skin tightening, but we found that the recovery time was comparable to that of surgical procedure.
Yeah, so patients had the same amount of swelling as they did with the surgical procedure, and the results from the surgical procedure last 7, 8, 9 times as long with the same type of recovery. Talk a little bit about the cost also, because the cost for this procedure was close to the cost of an operation, and that's also a concern with many patients.
You know, the cost maybe would have been worth it if we had found that the recovery time was significantly less, but when we factor in the cost of the FaceTite plus the recovery time, it just didn't make sense to recommend it over surgery anymore.
Yeah, I agree with you. I found that a lot of these patients were candidates for a facelift, and they were candidates for a facelift the moment they came into the office, but for whatever reason, either they wanted something that cost less, or they wanted that recovery that was a little bit shorter. They were able to follow that FaceTite track, but as we found out, that wasn't necessarily the case, and that's why we've gone away from FaceTite. Talk a little bit about the skin tightening that we now do with lasers as compared to maybe some of the processes that we were doing before with the plasma gel and that kind of thing. How has that evolved?
Plasma gel, we were originally using it as an all-natural filler, where we would take a patient's blood, extract out the PRF or the platelet-rich portion of the blood, heat it to a gel that was very similar in consistency to hyaluronic acid fillers. And while the results were beautiful, that just didn't last long. Studies have found that up to 70% of the volume with those fillers dissipates within 3 months.
That's amazing.
Right.
Yeah.
So patients would be happy with the results, but then disappointed with.
After 3 months. And like you're saying, there are fillers that actually last a lot longer and yield as good, if not better, results than the plasma procedure. Right?
Yes, absolutely. And while some people still really liked the all-natural factor of the plasma, the fillers that we use that are made of hyaluronic acid, that is something that's already found naturally in our skin and hair. It really does give beautiful, predictable, long-lasting results.
And natural, too.
Absolutely.
Let's talk about the fractional procedures that you do, and how has this integrated itself in your practice in terms of the concerns that it addresses, and where were we before we had this Cyton machine, which has been excellent?
Yes, I'm very excited about the hybrid fractional laser treatments. I've been seeing beautiful results, and it's newer technology, so some of the older technology like a deep chemical peel or a CO2 laser, while they give beautiful results, the downtime, it can be very difficult for people, up to 2 weeks of really not being able to go to social activities or work. The new laser just gives beautiful results, skin brightening, firming, and helps with hyperpigmentation. So it's been really great, and the downtime is really much less significant, up to a week maybe.
That's a big difference.
It is, with people want to do something good for their skin and get on with their lives.
Right.
So.
Having done a lot of peels on patients throughout my career, I know that there is no peel that recovers in 7 days. So I'm glad that there's a technology out there that has that short recovery.
Yes, and in addition, it's much more comfortable.
Right.
I like to get a scale of 1 to 10, and I get about a 5 during the treatment.
During the procedure.
And they're fine afterwards.
Okay.
So I love it.
That's
I
wonderful.
recommend it twice a year for maintenance, just to
Right.
get that collagen stimulation and keeping the skin bright and beautiful.
And I've seen some of Becky's results, and they really are amazing as far as the skin and the changes that the Cyton machine affects in the skin. So today we've talked about this evolution within our practice, and these technologies, like I said earlier, are all technologies that are specifically results-based. We don't jump on trends. We don't jump on bandwagons in this practice. I always like to think that I watch things and see how technology evolves before I try things on my patients. Please log on to our website so you can learn more about all of these technologies and offerings that we have at Garcia Facial Plastic Surgery. Thank you all very much for watching.